Obesity is a medical disease. Just like any other medical disease, high blood pressure, diabetes, similarly, the disease of morbid obesity is a complex medical condition with multiple underlying etiologies. Bariatric surgery or obesity surgery is a very safe, effective, and proven tool for treating the disease of morbid obesity. It causes usually at least 70 to 100 pounds of weight loss. It increases patients' metabolism. It corrects underlying health problems and metabolic problems, including diabetes and blood pressure. And it is also very safe, as I mentioned. The risks of bariatric surgery are less than 1% in general. Bariatric surgery is not cosmetic surgery. Cosmetics is a nice side benefit of bariatric surgery. I tell my patients they'll be fitting into smaller clothes and they can go shop in the regular stores instead of the big and tall stores. But really, we're not doing it for a purpose of cosmesis. We're doing bariatric surgery for the purpose of health. It usually helps people get rid of their medical conditions. For women, it increases fertility. For those who are diabetic, it'll often get rid of the medications they're on for diabetes, including insulin, Januvia, Janumet, and multiple other drugs for hypertension. It improves their sleep apnea. It decreases the risk of death from cancer, decreases the risk of death from sleep apnea. So overall, it lets the patients live much longer. It gives them a longer life expectancy. It has nothing to do with cosmetic surgery, although yes, that is definitely a good and well-liked side benefit of bariatric surgery. The options of bariatric surgery include the gastric balloon, the gastric band, the gastric sleeve, and the gastric bypass. Those are the ones we offer. And that basically encompasses about 95 to 98% of surgeries that are done around the world for obesity surgery. The most popular option is the gastric sleeve. In the gastric sleeve, we remove about 70% of a patient's stomach, and removing that portion of your stomach not only lessens the capacity of the stomach from 2 liters down to about 16 ounces or 300 mLs, but in addition to removing the stomach and making it smaller, we're also causing a huge hormonal impact. And the hormonal and metabolic impact is what makes the big difference, because patients often come back saying they don't have any desire to eat. They don't have the cravings they used to get. So that's why the bariatric surgery works as well as it does. In addition, the other options, which are not as popular anymore, include the lap band, which is a silicone ring that goes around the top portion of your stomach and at the bottom of your esophagus. And the last one is the gastric bypass, which also is a great option for patients who are really bad diabetics. They're taking 100 units of insulin or more, and they need a procedure which is life-saving, which will reverse their diabetes. Overall, even the gastric sleeve can reverse their diabetes. So we make a decision when we meet with the patient and decide which option is best suited for the patient based on their underlying medical conditions. So prior to the surgery, you're going to need a few things done. One of the requirements prior to surgery is, as I mentioned, to see the nutritionist. The nutritionist is going to teach you, once again, how to eat and how to change your relationship with food. In addition, you're going to require to see a psychiatrist, and the psychiatrist is usually just one visit, so that we understand that you're able to follow and comprehend and make changes that we are requiring you to make. In addition, you'll be required to do a bariatric set of labs, which we look at all your hormonal levels and vitamins to see if anything we can correct before surgery or after surgery to help your metabolism and help you lose weight. In addition, we do an ultrasound for those patients who still have a gallbladder. We also may recommend a sleep apnea test depending on how you answer your questions when you come in to see us. And we may recommend that you see a cardiologist or a pulmonologist. Gastric bypass surgery and gastric sleeve surgery, usually you're in the hospital for 1 day. For that first day, you have gassy pain, and the incisions, as you know, are small incisions about the tip of my finger. The biggest incision is about 2 finger breadths. So there isn't a lot of pain. Most patients don't complain of too much pain. In general, the first day tends to be the hardest for patients. Therefore, we keep them in the hospital for the first day, and we control their pain with painkillers. And when they go home, they're usually not taking that many painkillers. After about day 3 or day 4, they're on their own. They report back to me saying they don't find it necessary to take painkillers after the first 3 or 4 days. So how much weight can you expect to lose after bariatric surgery? Well, you can expect to lose anywhere from 60 to 120 pounds. Let me expand on that a little bit. So I could do the same exact surgery on 2 patients. The average weight loss tends to be around 60 to 70 pounds. However, the patient that loses 100 pounds or more is also following the other dietary and lifestyle requirements that we are so proud of and we incorporate into our program. So we have a bariatric coordinator who you'll meet shortly, Diane Arquetti, as well as we have a nutritionist in the program, we have support groups in the program, and we teach you on everyday basis what to eat, what not to eat, how to chew your food before surgery as well as after surgery. One of the key requirements after the surgery is to drink 60 to 80 grams of protein along with 60 to 80 ounces of fluid per day. And we're going to teach you how to do that. My entire team is dedicated in finding out which products have the right amount of protein and the right amount of sugar so these patients are eating the right foods so that we can help the patient achieve the maximum weight loss.
So as the bariatric coordinator, I meet with all the patients prior to surgery at their first consultation. My responsibilities include guiding them through the process, educating them along the way, and assisting them to get all of their prerequisites done so that they are in the best shape possible prior to surgery. After surgery, we are there to assist them in their post-operative responsibilities and getting them back to a normal life. We start by walking, we reinforce their diet and their phases of their diet, and get them back to their activities so that they can get back to their normal lives. Support group is vital for anybody who's going through this process. As professionals, we can teach you and guide you, and we can implement everything that we can, but it's really that peer-to-peer support that help people get through their struggles and through their challenges. When they can see people like themselves who have gone through that same process get over onto the other side and engage health and wellness. And it's not only what they can learn from their peers, but I always tell patients that it's what, when you come to support group, it's what you can share and teach somebody else. You never know who's going to inspire you. Life after bariatric surgery can sometimes pose challenges. We're here to help you assist in those challenges, learn your phases of your diet, adjust to your hydration levels, and make sure that you're getting adequate hydration along the way. And we help patients with support groups, getting back to normal activities, and help them engage in healthy lifestyle activities along the way. The age range here is 18 to 79 years old. It really depends on the person's engagement in the program and what they're willing to do for their health and wellness.
Will you be able to eat regular food after surgery ever again? That's a great question. And the answer is yes. I have plenty of patients who go out with their families and they ask me, can we go out, to a restaurant to eat? And oftentimes they're bringing their portions home. I like to also tell at this point that the portions in the United States are about 3 to 4 times larger than they are in Europe. A regular portion of meat is about 4 ounces or a deck of cards. In the United States, the portions tend to be 3 to 4 times larger. So the answer is yes, you can eat regular food, however, it's going to be small portions. I have some patients who can eat pastas, who can eat rice, who can eat chicken, fish, but there are some patients who will not be able to eat, for example, a piece of bread because it's too dry. And another patient may be able to eat bread, but they may not be able to eat rice. I kind of explain this in a similar way as having a newborn child. Let's say if you have 2 newborn infants, one of them may be able to eat squash and the other one may spit it out. Similarly, my bariatric patients are like babies. After surgery, for the first couple of weeks, we really monitor their dietary intake and we help them progressively progress from one stage to the next. And if they're able to progress in one stage, we move them to the next. If they're not able to progress, we keep them on the same stage. And therefore, eventually, most patients are able to get to regular diet in about 4 to 6 weeks after surgery. So does insurance cover bariatric surgery? And the answer is absolutely yes. In the state of New Jersey, bariatric surgery is a core benefit, meaning it's one of the required coverages. Just like your insurance is required to pay for your diabetes or your high blood pressure medication, obesity is considered a medical disease. Morbid obesity, the treatment of morbid obesity by the means of bariatric surgery is no different than getting coverage for your breast cancer surgery or getting coverage for your heart surgery or your hernia surgery. So therefore, this is not a cosmetic surgery. This is not something you pay out of pocket for. This is a covered benefit. Of course, some patients may have their deductibles and they have to meet those deductibles, but overall, it is a covered benefit. So how long will you be out of work after surgery? Usually I tell patients to take the first 2 weeks off. And that's not because they're in terrible pain or terrible discomfort. Usually, as I said, patients go home the next day after surgery. I tell them for the first 2 weeks to really take their time, eating, and drinking. They have a requirement of 64 ounces per day. In order for them to meet that requirement, they cannot guzzle or gulp the fluids. So they have to take a sip every 10 minutes, every 15 minutes. I tell them take a sip and put the bottle down. And this is very important so that they can get their hydration. If I send them to work too quickly, I'm afraid they may not have enough time. As you know, we live in a very fast-paced environment, and they may get only 15 minutes to eat or drink. Therefore, I tell the patients the first 2 weeks they're learning the size of their new stomach, and they're learning how to get adequate hydration. So that's a great question. Do I gain weight back after bariatric surgery? And the answer is 85 to 90% of people do not gain the weight back, especially if you come to groups like ours. Here at Robert Wood, we have a support group, which we're very proud of, which we meet nowadays because of COVID-19. We're doing our support group virtually. So if you come to support groups, you have an 85 to 90% chance of not gaining weight back after surgery. We have patients 5 years out, 10, 15 years out across the country after bariatric surgery who are doing very well. The data is like this. 85 to 90% of patients after surgery do not gain the weight back. 85 to 90% of patients who lose weight without surgery, such as Weight Watchers and other diets, tend to gain the weight back, because those other mechanisms do not address the underlying problem with obesity, which is correcting your hormonals. The other methods for weight loss, such as Weight Watchers, Jenny Craig, Atkins, and the other diets, do not address the other hormonal issues that are present with obesity. Bariatric surgery is the only option that addresses that, and therefore the weight loss is sustained. So let's talk about starting a family after bariatric surgery. So after bariatric surgery, I recommend that you wait at least a year. The first year is when you're losing a lot of weight and there is an increased risk of birth defects, so I don't want you getting pregnant for the first year. After the first year, as long as you're taking vitamins and you're following up appropriately with me as well as your OBGYN doctor, you're able to have kids. Actually, bariatric surgery has been shown to increase fertility, and I have many patients who have had successful pregnancies after surgery. So one of the questions I get asked a lot is, what about loose skin after surgery? So as far as that's concerned, it really depends on your age, your genetics, your skin type, and how much weight you lose and how quickly you lose. On average, I would say about half my patients have to have something done and the other half have nothing done. So that could include a paniculectomy, meaning removing the extra skin from around your abdomen. If the patient is getting rashes, sometimes the insurance will cover it. If the patient has a hernia, definitely sometimes the insurance will cover it. But otherwise, we have options such as removing the excess skin, which is called a paniculectomy, as well as a hernia repair. A lot of patients also get loose skin under their arms. And when they do, we have options or products available right now in 2020 which are non-invasive, where we don't have to cut. So we can slap on these paddles on patients' thighs or patients' arms, which deliver radiofrequency energy, which help the appearance of loose skin and tighten up the skin. BMI stands for body mass index, and body mass index is a simple way of measuring obesity. Just like we measure temperature in degrees centigrade or degrees Fahrenheit, we measure obesity with a number called BMI. And BMI is simply a ratio of your height to your weight. So you take your weight in kilograms and you divide it by your height in meters squared. Or you take your height in inches or your weight in pounds and you divide it by your height in inches. And we come up with a number. If that number is greater than 40, then you qualify for surgery. A simpler way of saying that would be, in general, if you're 100 pounds overweight, you qualify for surgery. But based on your height, we precisely measure a number called BMI, which tells us whether or not you qualify. Now, BMI greater than 40 is considered class 3 obesity. In other words, the risk of surgery is smaller than the potential benefits. And at that point, the risk of not doing surgery actually outweighs the risk of having surgery. In addition, if your body mass index is less than 40, so if you're between 35 to 40, which is what we call class 2 obesity, and you have a medical problem such as high blood pressure, diabetes, sleep apnea, reflux, arthritis, or any of the other medical problems, then once again, you qualify for surgery. Because of the medical conditions, it is more safe for you to have the surgery than to not have the surgery, and you'll live longer and healthier by having surgery.
When people choose bariatric surgery, it actually affects the whole family. Their role in the family may be different, or how they're perceived in the family may be different. So it lets people really embrace the positivity and what they can do and what they can provide in their life. Family's important. Family's so important for support because nobody goes through this alone. When you're in a family, you're eating together, you have same activities, your sleep is better. It just provides for a better quality of life. We recently had a patient who came in and had difficulty just walking down the hall, short of breath, not being able to take care of himself. And he was inspired by his daughter who was going to have a baby. And now, 60 pounds less, still on his journey, he's able to share some moments with that grandchild, take that grandchild on a stroll, and really participate in those family activities that when he was heavier, he could have never experienced. Bariatric surgery is an amazing tool that helps people live the life that they deserve to live. When you choose bariatric surgery, you're looking for a better lifestyle, health, wellness, longevity, and to share in those special moments in life. And I get to witness that every single day.
RWJ Barnabas Health. Let's be healthy together.